All right, let's dive in. Today, we're tackling tablets.
Tablets, huh? Sounds simple, but
But there's way more to it than meets the eye, right?
absolutely. We're going deep thanks to this university lecture.
Dense stuff, but fascinating.
Yeah, it gets pretty technical, but don't worry, we'll make it fun.
So first things first, what is a tablet, officially speaking?
Okay, so the lecture says it's a solid unit dosage form, with or without extra stuff, made by molding or compressing.
So basically a little package of medicine all ready to go.
Precisely. And that leads to one of their biggest advantages: precise dosage.
Makes sense. Way easier than measuring out liquids, right?
Exactly. Especially important for potent medications like heart meds, where getting the dose right is critical.
No room for error there.
Right, and tablets are super stable too, chemically, mechanically, even microbiologically. They last a long time.
Unlike that bottle of cough syrup that's been in my fridge for who knows how long.
Exactly. Tablets are way less susceptible to things like temperature changes or contamination.
Good to know. And of course, they're so convenient.
Absolutely. Small, easy to carry, discreet.
And they can hide those awful medicine tastes.
Oh, for sure. Remember those liquid antibiotics as a kid?
Ugh, don't remind me.
Okay.
So tablets are versatile, convenient, stable. What's the catch?
Well, there are some limitations. Some drugs just don't work well in tablet form.
Like what?
Things like protein-based drugs like insulin. The digestive system can be harsh. Proteins are delicate.
Ah, so injections are better in those cases.
Right. And absorption can be tricky with some drugs. Might need a higher dose in tablet form compared to an injection.
So even though they're designed to be taken orally, doesn't always mean perfect absorption.
Exactly. And not all substances are easy to compress into a tablet. Some are too sticky, too fluffy, too brittle.
So manufacturing can be a challenge.
It can. And then there's this thing called first-pass metabolism, which can be a hurdle.
You mentioned that earlier. Can you explain what that means?
Okay, imagine you're on a road trip, heading to your destination, right?
Okay. Road trip. Got it.
But you hit a toll booth. Gotta pay a fee before you can continue.
Okay, I see where you're going with this.
That's kind of like first-pass metabolism. Some drugs, before they even reach the bloodstream, they get partially broken down by the liver.
So they lose some of their power along the way.
Yeah, like paying a toll. It's something drug developers have to consider, especially for drugs processed heavily by the liver.
Wow, I never thought about it like that. So with all these factors, what makes a good tablet?
Well, the lecture lays out some key requirements. Size and shape are super important for swallowing.
Makes sense. You don't want a tablet you can't swallow.
Right. And uniformity is key. Consistent weight, appearance, diameter, no weird defects.
Consistency is crucial with medication. You want to know you're getting the same thing every time.
Absolutely. Durability matters too. Gotta survive manufacturing and transport without crumbling.
Would not be so hard it doesn't break down on the body, right?
Exactly. It's a balance. And of course, accurate dosage is paramount. Each tablet has to contain the right amount of medication within very strict limits.
So precise measurements are key at every step.
Absolutely. They also need to disintegrate properly in water unless they're designed to be slow release, of course.
So they have to dissolve efficiently.
Yep. And last but not least, stability. Air, temperature, moisture, they got to hold up in various conditions.
Wow, so much goes into these tiny pills.
Right. And we haven't even talked about all the different types of tablets. It's more than just your basic pill.
I had no idea. Lay on me. What kind of tablets are we talking about?
All right, first up, we have molded tablets and compressed tablets.
Okay, tell me about these molded tablets.
They're the simpler kind, flat, circular, just the drug, plus a diluent. Completely soluble. They're called tablet triturates.
So kind of like the classic original tablets.
You could say that. Now, compressed tablets, those are the most common. Made by compressing a mix of the drug and other ingredients called excipients using a machine called a tablet press.
Okay, so compressed tablets are like the main event, and there are different varieties within that, right?
You got it. We've got your basic oral tablets, then sugar-coated, film-coated, enteric-coated.
Whoa, slow down. Let's break those down one by one. What's the deal with oral compressed tablets?
Those are the workhorses, designed to disintegrate quickly. Think your basic pain reliever or allergy pill.
Okay, got it. What about those shiny coated ones? Always seem fancy to me.
Ah, those are film-coated. That coating masks taste, protects the medication, and can even control the release of the drug.
So it's like a protective shell and a makeover. What about the enteric-coated ones?
Those are strategic. They resist stomach acid, dissolving only in the intestines.
Why bypass the stomach?
Some drugs get destroyed by stomach acid, so the coating protects them. Other times, it's about protecting the stomach lining from irritation.
Interesting. So it's like delivering the medicine to the right spot at the right time.
Exactly. Now, things get even more complex with multiple compressed tablets.
Multiple compressed. What does that even mean?
Think tablets within tablets. They're made in layers, which can separate ingredients that don't get along or provide phased releases.
Whoa, like a built-in time release.
Yep. And speaking of time release, we have controlled release tablets. They release medications slowly and steadily.
That must be a game changer for folks who take meds regularly.
Totally. Less frequent dosing, better compliance. And then there's the fun stuff, like chewable tablets.
Oh, yeah. Those chalky kids' vitamins.
Exactly. No disintegrant needed, lots of flavors. Then you have Bacal and sublingual tablets, the ones that dissolve in your mouth.
Right. So where you put them matters.
It does. Bacal in the cheek, sublingual under the tongue,
Uh-huh.
different absorption rates and speeds of action.
Targeted delivery? What else is there?
We have lozenges, those slow dissolving heroes for sore throats. And then we get into more specialized territory.
Like what?
Dental cones. Those go in the empty socket after a tooth extraction. Antibacterial action right where you need it.
Wow, so specific.
And then there are those tiny ones for the eyes, ophthalmic tablets.
So tiny. How do they even fit medicine in there?
It's amazing, right? Then we have implants, sterile, solid cylinders inserted under the skin, long-lasting drug delivery.
Like a slow-release implant.
Exactly. And vaginal tablets for localized treatment there.
So many options.
And let's not forget the fizzy fun effervescent tablets.
Those are always a good time.
Right. And then you have solution tablets for making antiseptic solutions and stuff.
Drop it in water and you're good to go.
And lastly, we have a bit of a throwback hypodermic tablets. Dissolve and then inject.
Wow. Like a precursor to modern injectables.
It is. And that, my friend, is a whirlwind tour of tablet types.
I'm blown away by the variety. Never knew there was so much to learn about tablets.
It's a fascinating world, and we've only just scratched the surface. Next, we'll go behind the scenes and see how these tiny marvels are actually made.
Can't wait. This is getting good.
Welcome back. Ready to see how these tiny wonders are made?
I'm all ears. After all those different types of tablets, I'm dying to know how they go from powder to pill.
Well, it all starts with a machine called a tablet press.
Okay, paint me a picture. What's this tablet press like?
Imagine a giant, high-tech printing press. But instead of ink and paper, it's churning out those perfectly formed tablets.
Wow, that's high tech. But I'm also picturing those old-timey hand-cranked presses. Do those still exist?
They do. They're called single-station presses, and they're perfect for smaller batches or for research. It's like the difference between a home bakery and a giant factory.
Makes sense. So you've got the powder, you've got the press. What else goes into tablet making?
Well, to get that perfect shape, you need these specialized tools called punches and dies.
Punches and dies. What are those?
Think of a mold with an upper and a lower punch that compresses the powder into the desired form.
So they're like tiny cookie cutters for medicine. I love it.
Exactly. But before we get to the pressing, there are a few ways to prepare the powder.
Oh, interesting. Like what?
Our lecture mentions 3 main methods: direct compression, dry granulation, and wet granulation.
Okay, let's break those down. What's direct compression?
Direct compression is the simplest. You mix the drug with other ingredients, those are called excipients, and bam, straight to compression.
So it's like a one-step process, mix and press.
Pretty much. Works great for drugs that are naturally easy to compress, but not all drugs are so cooperative.
Right, so what about dry granulation? When would they use that?
Dry granulation is like adding a prep step for those less cooperative drugs. It involves something called slugging.
Slugging, what's that?
They basically compress the powder into big chunks called slugs. Then they break those down into smaller granules that flow better.
So it's like pre-compressing the powder to make it easier to work with.
You got it. Now, for wet granulation, they use a liquid binder to help the powder stick together.
So it's like adding a bit of glue.
Exactly. The liquid helps form granules, which are then dried and compressed into tablets.
Interesting. So direct compression, dry granulation with slugging, and wet granulation with a binder. How do they decide which method to use?
It all depends on the drug and what kind of tablet they're aiming for. Some drugs are sensitive to moisture, so wet granulation wouldn't work. Others might need specific excipients that work best with one method over another.
It sounds like a lot of science goes into choosing the right method.
It definitely does. And once the tablets are pressed, the process isn't over. There's a whole world of quality control and packaging to ensure they meet those strict standards.
Makes sense. So much goes into making sure each tablet is safe and effective.
Absolutely. And we haven't even talked about those excipients we mentioned earlier. They play a crucial role in how the tablet works.
Oh, excipients. Sounds mysterious. Tell me more.
Yeah.
All right, we're back and ready to unravel the mystery of those excipients.
They're pretty cool,
Now,
actually.
remind me, what are they exactly?
Basically, they're the inactive ingredients that get added to the drug in a tablet.
Inactive. So why are they even there?
Oh, they're crucial. They help with everything from how the tablet is made to how it works in your body.
So they're like the support team, making sure the drug, the star player, can do its job.
Perfect analogy. Some excipients bulk up the tablet so it's a manageable size.
Makes sense. I've definitely seen some tiny pills out there.
Right. And others help the powder flow smoothly during manufacturing, keep things running smoothly on the tablet press.
So they're like the stage crew, ensuring the show goes on without a hitch.
Exactly. And then you've got binders, which hold the tablet together.
Otherwise, it would just crumble, right?
Yep. And disintegrants, those help the tablet break apart in your stomach or intestines.
So the drug can be absorbed properly. It's amazing how each one has a specific job.
It really is. Like a well-oiled machine, everything has its place.
So what are some of the common ones? What kind of things are we talking about?
There are a lot. Starches, sugars, cellulose derivatives, those are often used as diluents and binders.
Okay. And what else?
Lubricants, like magnesium and stearate, they prevent the tablet from sticking to the machines.
So it's like oiling the gears.
Exactly. And then there are glidants. Those improve the flow of the powder mixture.
All about consistency.
Right. And we can't forget about colors and flavors.
Especially for kids' meds. Make them a little more appealing.
Exactly. It's really quite amazing how much goes into choosing the right excipients.
It's like they're formulating a recipe, but for medicine.
That's a great way to think about it.
Yeah. Now, I'm curious, what about the future of tablets? Are there any exciting new developments in the works?
Oh, absolutely. Things are always evolving.
Like what kind of cool stuff are they working on?
Well, one area that's super exciting is 3D printing.
3D printed tablets. What?
Yeah, it allows for some really complex shapes and customized drug release.
Woo. So a tablet could release different drugs at different times.
Exactly. Or even target specific areas of the body.
That's incredible. What else?
Nanotechnology is another big one.
Nano.
Yeah, using nanoparticles to enhance things like solubility and absorption.
So like tiny robots delivering medicine. Yeah.
You got it. And there's a lot of research into biodegradable and biocompatible polymers.
Polymers.
Yeah, they dissolve harmlessly in the body, so you might not even need some of those traditional excipients.
That's super cool.
And get this, there are even smart tablets in development.
Smart tablets. Like what, with Wi-Fi?
Haha, not quite. But they can be controlled remotely or respond to things happening in the body. Release medication only when it's needed.
That's mind-blowing. It seems like the future of tablets is wide open.
It really is. It's amazing to think about the possibilities and how these advancements will impact how we take care of our health.
It's been a wild ride. From swallowing a pill to the cutting edge of pharmaceutical technology, who knew there was so much to learn about tablets?
It's been fun. We've covered so much, from those everyday pills to the future of tablet tech.
Thanks for taking us on this deep dive. And to everyone listening, thanks for joining us. Until next time, keep those brains buzzing.